This is the Alabama's 13 Making a Difference Holiday Special.
Welcome back. We're glad you're joining us. Here's a fact. 1 in 6 men will be diagnosed with prostate cancer. That's according to the American Cancer Society. Many more will go undiagnosed until it's too late, simply because they don't want to deal with the exam or maybe they don't have insurance. But one Making a Difference award winner is doing everything he can to change that, even if it means not charging his patients.
A lot of men would probably rather have a root canal than visit the urologist. The prostate exam definitely on the list of things men hate. Dr. Vincent Bivens totally understands that.
Most men typically don't. You can listen to my lungs, you can listen to my heart, but I don't think I want a prostate exam. Culturally, we just feel that that's invading.
Because of that, Bivens sees men who come in when it's too late, leading to a painful, unnecessary death. Prostate cancer is a silent killer. Like ovarian cancer, usually there are no signs or symptoms. Some men simply don't come in because they don't have insurance. In those cases, Dr. Bivens does all he can to absorb the cost on everything from testing to surgery. In some cases, it's all free.
Sometimes that may be going to the hospitals and asking if the hospitals can defray some of their costs. Sometimes we just don't worry about, from our standpoint, charging a patient. We do what we can, reducing the cost of surgery.
His concern and generosity is saving lives, so one of his nurses, Joyce Bean, nominated him for the NBC 13 HD Making a Difference Award, which he humbly accepted.
I don't think that I deserve this, but certainly I think a lot of my physician partners, a lot of my friends that are physicians, nurses, staff, and all the hospitals that I work at, I think they certainly deserve it.
The Reverend O.C. Oden Jr. is a patient of Dr. Bivens. He says the doctor is also making a difference through outreach, going to churches to talk to men's groups.
Just to give that time to come in and to talk to men and encourage them to do, get some screening, check yourself, because it's a silent killer. And so he's deserving of it.
He is a lifesaver. He's a very good surgeon. Patients respect him. He serves them very well.
A lot of times the men will come in with disease that you can't even treat, you can't even cure, and that's preventable. And I think that if we can get the word out, the first step is getting people in. And if we can get them in, and then let us do what we can do to try to diagnose and try to treat, then I think we can make certainly I think we have made a difference.
Dr. Bivens and his team, they travel to places like Alabama's Black Belt communities. And that's where many men are dying because they can't afford treatment or they don't know enough about the testing. Bivens says prostate cancer is very survivable if only it's detected early. For information on screening, you can go to our website, alabamas13.com, and